How can long-term catheter use cause bladder cancer? Imagine living with a device that helps you go about your day, but over time, it might pose some health risks you need to know about. When someone uses a urinary catheter for a long period, it can sometimes lead to changes in the bladder that increase the chance of developing cancer. This mainly happens because the bladder lining becomes irritated and inflamed repeatedly. The catheter can cause constant mechanical irritation, which means it rubs against the bladder over and over again. This ongoing irritation often leads to infections called urinary tract infections. These infections further inflame the bladder lining, causing damage to the cells that normally protect the bladder. When these cells are repeatedly injured and then repair themselves, there's a higher chance for genetic mutations to occur. These mutations can sometimes lead to abnormal cell growth, which is how cancer begins. Specifically, the continuous presence of a catheter can cause a few key issues. First, it leads to chronic inflammation, which means the bladder lining is almost always inflamed. This persistent inflammation damages the cells and causes them to regenerate abnormally, increasing the risk of mutations. Second, recurrent infections from long-term catheter use make the inflammation worse, further damaging the bladder tissue. Third, over time, the bladder lining may undergo a process called metaplasia. This is when normal cells change into a different type, such as squamous cells, which are flat cells that line many parts of the body. This change is significant because it is a known precursor to squamous cell carcinoma, a type of bladder cancer linked to long-term irritation. People with certain conditions are at higher risk. For example, those with neurogenic bladder or spinal cord injuries often need long-term catheters and are more likely to develop bladder cancer. Studies show that the longer the catheter is used, especially beyond about 3 years, the higher the risk. Patients who use catheters for many years have a several times greater chance of developing bladder cancer compared to those who do not. The risk is also higher in middle-aged adults and those with other bladder conditions like stones, kidney disease, or high blood pressure. From a bladder health point of view, the main concern is that the constant irritation from a catheter disrupts the bladder's natural protective environment. This disruption can lead to changes in the cells lining the bladder, which may eventually become cancerous. To help reduce this risk, healthcare providers recommend careful monitoring for infections, trying to limit how long a catheter stays in place, and screening high-risk patients regularly for early signs of bladder cancer. In summary, long-term catheter use can cause bladder cancer mainly through ongoing inflammation and injury to the bladder lining, which increases the chance of genetic mutations and abnormal cell growth. If you or someone you know relies on a catheter long-term, it is important to work closely with healthcare professionals to manage risks and catch any issues early. Always consult a medical expert for personalized advice and regular checkups.